you for having me. Let me at the outset start with clarifying any confusion, and then I can address the individual, sort of concerns you have. Is that um, in no circumstance can we afford to relax our guard. The personal and societal safety measures that we have been taking with respect to the mask, distancing, and hand washing. Very simply put, let me start with that. Now coming to some of the mixed messaging, in case, within quotes, people are perceiving that, the number of cases are going up, but let's also realize that a few factors are responsible for this. One is number of tests have also increased. We're doing upwards of 8 lakh tests a day now, and that's gone up. That number has steadily gone up over the past weeks. So more testing, more reports, and more positives also. Number two, yes, the restrictions have eased, so people are moving around a lot more, and slowly and steadily we are opening up, public services, soon to be the metro, all of that. So I think those are some decisions which rightly so, in my opinion, have been taken to sort of move, the economy and people's livelihoods ahead.
Sure.
Having said that, we can't let our guard down. So essential things, let's continue to do them. Those people who need to go to work, have to go to work, they should. But the rest of the populace, if you don't really have to go to large marketplaces or have gatherings, all of that, then people shouldn't.
So the onus is now more on the people, on the public. The onus, like, we've had this messaging for months now: wear a mask, do social distancing, clean your hands constantly. So we've had that messaging. Now, as you said, the government also has to balance the economy and managing the pandemic. So now the onus is more on people to ensure that you are safe and you don't bring this infection into your home.
Absolutely. And let me address, one point here, with due sort of empathy, to the society at large, including myself, my family, all of us. There is a known phenomena called the pandemic fatigue, or in this case, COVID fatigue. It means, tiredness, everybody is now really worn down with the messaging. Initially, there was a threat of death, what's going to happen. All of that has now consistently been the case for 6 months and more. People are tired of it. There's burnout. They're at a point where, like, what, I don't care if I get the virus. They know a lot more. So that does happen. And there's a good analogy I read, something like a locker room speech is needed. When there's a sporting event and halftime, the team's battered and bruised go into that locker room, and their coach, is motivating them at that point and saying, don't give up now. It's the last mile. Don't give up now.
Right.
I think that's sort of what we need to keep in mind. Yes, we're all battered and bruised. We're emotionally exhausted, physically, all of that. Human beings are social beings. So yeah, all of that.
Right. Still, so briefly, doctor, I also find this sense is creeping in that, a lot of people have gone back to, it's just a virus. So many people are recovering. It's not, as big a deal as was being made out to be. And it's a dangerous sort of mindset, isn't it? That, people should, especially young people, revert to that sort of thinking.
It's a dangerous mindset because there are still a lot of unknowns about the virus. I would say there's more unknown still than that is known in terms of science. And so who it's going to, yes, we have some general guidelines: older people, people with illnesses, obesity, all of that, they are at higher risk. But we've seen other exceptions as well. So who the virus is going to hit badly and at what time, we don't know. So nobody can really let their guard down.
Absolutely.
And also, I will speak as a health professional. Remember that, you only have that many doctors and nurses, and they can't leave their jobs and are not leaving their jobs. So in the interest of them and keeping them safe to look after you, I think we all have to do our small bit, our small sacrifice.